maybe Sunday in other part of the world. But today we have a nice case, big case. This patient came because jaundice and cholangitis. Now he's in another hospital outside from here. But here we are working with Dr. Alcibar. Say hello, hello, hello. So so we have a big stone. It's not just a small stone. It's a big stone. She had a surgery 2 years ago, and now we will make a lithotripsy. I am using an 11 French um, cholangioscope, and I am using the Walls lithotriptor. This is a big lithotriptor. You can see there, right? Me falta el pedal. Acá está. So I will start to do the lithotripsy. You will see. And with this kind of technology, the most important is that now we can broke these stones in a better way, quickly and faster. So this is a nice case I wanted to share with you just for education proposals. But well, in Ecuador we have this kind of patients with big stones. Metamos un poquito de contraste para ver cómo va. So I will put contrast because I don't see very well. Too much slush now, and I need to continue to do. So the stone is little broken. You can see now. I need to work more. If you can see on X-ray. No tengo el retorno, dile. So you will see on the fluoroscopy, we are passing now contrast just to see how big is this stone. This stone is taking the whole common bile duct. You see? And also the patient have a kind of stent, I believe, huh? Okay. So you can see it's the whole. So I hope to finish today, but if not, you know, these kind of cases we already published it in Endoscopy International Open. So patients with the stones more than 2 centimeters, sometimes they need not just one, they need 2 or 3 sessions of lithotripsy, right? So now I will continue working. No tengo el retorno. ¿Dónde está? Ahí está. La tira un poquito hacia atrás. No, necesito en grande la colangioscopía. Anet. Y está en azul, no sé por qué está en azul. O allá se ve bien. Anet. Allá se ve bien. Anet. Okay. We have a technical issue. It's okay. No veo la sonda. La está adentro. Saca la sonda, empújala. Ahí. Ahí está bien. Ahí deja. ¿No tenemos imagen del colonoscopía? Ah, ok. So it's very important to clean very well. We are doing a very good cleanup of this. Sometimes just changing the position. Sigue azul, Annette. So now I see the stent, you see? So what happened in this patient is that they put it a stent, and the stent had a migration, and they never removed the stone. That is the problem. ¿Puedes ver si la colonoscopía ahí te funciona? Annette. No. So you can see in blue with MBI, cholangioscopy. No, that's not true. I'm just joking now. Ahora sí. Muy bien, Annette. Congratulations. So now we see very well that we broke the stone and also that the stone was recovered in the stent. You see? That is what's happening. And that's why this patient had cholangitis. But this patient had also a glucose 6 phosphate deficit, right? That's it. So that's why we cannot use too much medication. Some kind of medication we cannot use in this patient. So now I am trying to broke everything, you see? And it's very important to clean up. Okay, now, you see? I am breaking the stone. It's a big stone. But what I will do now is try to broke almost everything here inside. I am using a cholangioscope, 11 French cholangioscope, with a 2 mm working channel, so that's why I can use more power to broke this stone. I will change the position strategically, you see? Se te congeló la imagen, creo, Annette. Empuja un poquito afuera la esa. Empújalo más. I'm trying to change my position. So what we are doing now is creating a tunnel in the middle of this giant stone, right? Because for us it's very important to broke the stone at least in different size, and as was already published by the team of Sao Paulo by Dr. Francini, I think it's Tommaso Francini, right? So they show it that we can go faster just doing the lithotripsy and retaking this patient with a balloon dilation just to remove the whole stones. But I need to confirm at least that is the complete stone was broken. So now okay, pasemos contraste. So I will pass contrast now. Puedes ponerme en la colangiografía en grande. Eso, muy bien. So now we will pass contrast. So I believe we broken, huh? So you can see now, I don't see more like the big stone that I saw it first, which is good. Here maybe. Okay. There is still a little bit here that I need to work. Okay, so now I will continue here. Okay. So I need to work in this area, right? You can see now. It's much better. So I broken from the distal part to the proximal part, you see. This is the way that I start to do it here. But it's good, Now I need to clean very well. Very, very well. So other tip that I can say to you now is that I move sometimes a little bit just my scope, my duodenoscope and not the cholangioscope, because I am in a very difficult position with this patient. But you see, I changed the position and I put in a better position just because of the movement of my duodenoscope, right? Which is very important, that you need to understand how the movement can be created inside. And I am not moving my cholangioscope. I am not moving the the wheels of the cholangoscope. I am just moving the duodenoscope to get a better position. So it was a big stone, and I believe we just finished. I believe. Let me see. So now I have another situation. The other situation is that we have let's see, what is the difficult of this case? We have also a plastic stent inside. What I can say about this stent is that this stent was a short stent, so this stent was not so good for drain the patient completely, and that's why this happened. I don't know where they put it or when, because we don't have nothing in the clinical history records of this patient, but I believe we are doing a good job now. So when the patient have cholangitis, it's always important to have a good drainage, good antibiotic cover. And this patient already have this. She doesn't have a good drainage, but she's not more in cholangitis, right? Because when you are doing ERCP and she's still in cholangitis and you are still doing like this kind of treatment, you can have a shock, because the bacterial can go outside, go inside the blood and make a shock, septic shock. So it's very important to take care about that. So if the patient is in cholangitis, first treat the cholangitis, making a drainage, putting a stent, putting more fluids, put antibiotics, and when it's stable, you can treat the patient. You see? I am just moving my duodenoscope now to try to change the position. Okay. Vamos a poner contraste. So I will pass contrast now. Okay, now almost outside. Okay, un ratito. Déjame sacar el colangioscopio. So I will remove the cholangioscope. The position is not so easy for this patient. I will remove the air. No, un balón. So now I will try to use a balloon. Preparemos un balón para dilatación de vía biliar. So I will make the balloon dilation also. Sí, con el balón. So I will use now a retrieval balloon just for injection. I want to see how it is. If I can start to make the remove of the stones. Okay, now. So it's here. So you can see it's in a lateral position. It's a little bit difficult. Pasa la guía por adentro. ¿Qué cosa? ¿De qué hago? ¿Qué pasa, Juan? Little tricky, ¿eh? Pues la guía. Sigue, sigue, sigue. Tengo un poquito para subir. Okay, so now I am better. It's a little bit difficult, so infla el balón. So now we will make a big injection now. Sí, sí. So now you can see the stone is completely destroyed, to my opinion. Maybe I am wrong, but there is still stones inside the biliary tract, right? So what I need now to do is push, 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 push the guide wire. Now I will try to desinfla el balón. Vamos a dilatar. I will make a balloon dilation until uno de 10, 11 y 12 milímetros de balón de dilatación. So I will use a balloon dilation. It's not the same, huh? So desinfla el balón. Bueno. Okay. Empuja. Empuja la guía. Empuja más la guía. So why a balloon dilation, right? This is one of the questions that you need to make in your head. So because the biliary tract is very dilated, so I need more space down. I don't want to cut more because I can have a complication, right? So I prefer to make a balloon dilation. There is a good sphincterotomy. I don't want that this patient bleed a lot, so I need to make a calibration of the sphincter now. And once I get a big dilation, now I can try to remove by part and try to remove that stent that is inside, because maybe this stent have 2 years. I don't know. Which needed to be removed 4 months after they put it for first time. But well, ten. 10. No, momento. Momento. Se te vino la guía. Se te salió la guía. Retira la guía. Retira. Retira la guía. Retira más. Más, más, más. Okay. Más, 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 más. Okay. So it's not a big problem. Now we need to go inside again. Okay, now we are inside. Empuja la guía. Empuja la guía. You see? Now I'm inside again. Retira y empuja no. La guía. Empuja, 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 empuja. Sigue, 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 sigue. Sigue, sigue, sigue. Más. Bien adentro. Más. Empuja más la guía. Ok, ahí nomás. Vamos a dilatar. Ok, dilata. Hasta 10 todo. So now we are doing a balloon dilation. You can see here. Sigue. Hasta 10 primero. Ok, sigue hasta 11. So now I am in 10. I need to go to 11. Sigue todo hasta 12. And now I am going to 12. Okay. Doce. Okay. Okay, now I will deflate, desinflemo, y préstame un balón de extracción. So now I have more space to remove everything, and that's my goal here today. Okay, de nuevo vuelve a insuflar. So I have a small bleeding, you see here. So what I will do now is again to make a tamponate with the same balloon, right? I will say like 2 minutes. I need to do this because I need to avoid to use too much medication in this patient because of her condition. So I will do a tamponade now. Balloon tamponade. With the same balloon that you use it, you make the inflation of the balloon until 12 and you stay there 2 minutes. So we are just waiting just to see if the tamponade works. So this is very important. If you see the bleeding, you need to stop the bleeding, even in ERCP. Similar to the surgeons, right? Okay. Now we will deflate. We will see again. Okay. So now I believe we are done. I will stop the alarm. Now we are fine. Empujar aquí un poquito. You see? There's no more bleeding, and that's which is good. And the stones are going out now. You see? Which is also good, right? Empujar aquí. No more bleeding. Very well dilated. Good drainage. And just with aspiration, the stone is starting coming out. You see? So it's another tip. If you have a big dilation, if you just make an aspiration, it will start to going out. It will help you. At the end, I will put a little bit of adrenaline. No, yo le voy a poner. Just to be sure that this patient will not bleed during the weekend. So in that way, I will be sure that I will have a good rest Sunday, right? So now, inflator. So I will try to see if I can remove the stent just with the balloon, you see? I believe I will, probably, I will achieve, let's see, because a stone is coming also, you see? The sludge of the stone is coming, which is good. It's going out. So in theory, it's going out, huh? You can see how big is this stone. So thank you for sending me this patient. It's coming out. The stent is coming out also, you see? So this is very important. When you have a stone and a stent like this, you see the stent now, you see? If you do a very good lithotripsy and you do a very good dilation, it will come out. Just as I am doing now, you see? Ok, desinfla un poquito. Ok. Ten para subir. So I will make a reposition now. Infla. Okay, now perfect. I'm taking the long position to see if I can remove a little bit more. To try now. Now it's better, right? Ok, desinfla. Para ver si lo agarramos con un asa. Ok, dame un asa. Una pinza de cuerpo extraño. So I will retake out, I will move out the stent, and then I will continue to remove the sludge and the stone that is broken now. It's nice. So I think it's we need more studies now comparing old technology lithotripsy with this new one, because I believe, you know, in big stones it's very interesting what we are seeing. Before, normally I had to take 2 or 3 sessions of lithotripsy, but now with this technology it's easier. Not so faster, but easier, huh? So now, abre, abre. No. Cierra. Cerraste. So now we had the stent, you see? It's okay. So now I am removing this stent. I need to take out. It's much better if I remove it once. It's too short, this stent. Abre. Cierra. People doesn't understand sometimes that the stents, short stent is just when you have a small stone. If you have a big stone, a short stent will not solve the problem. And this is the other thing. Always select the right stent. Sorry. Okay. Now I will continue to remove the sludge. So now with the dream team, Doctor Alcibar, Doctora Lisette Pinargote, Doctora Nelly, and Doctor Angelica, right? The dream team. Always the best. Huh? So, it's just a small opinion, huh? Mueve la guía, por favor. Ok, ten ahí. Ok, inyecta. No. Ok, infla el balón. So you see now, empuja la guía. Now I am just removing the stone, you see? Very well. Oh, look, how much? Very big stone. Ok, desinfla un poquito. Sí, desinfla un poquito. I'm trying to deflate a little bit. Okay, now it's perfect. Okay, desinfla. Oh, it's good. Sí, está bien. Okay. Then. Okay. Infla. Infla. It's just about. Oh my god. Big stone, huh? Okay, you see? And get out. So one part is get out, is good. Okay, desinfla. O sea, desinfló solo. Okay. And now. Sí, dame un segundo. Infla. So we need to clean from the. Desinfla un poquito. Okay. Okay, desinfla. Okay, pon contraste. O inyecta. Solo agua, mete agua. So I will flush with water. Okay, infla. Desinfla. You see? So I am cleaning and cleaning and cleaning. There is the work here. You see? Very big. Now papilla is very big and I need to clean up more. Ten. Empuja la vida. Okay. Okay. Inyectemos contraste. Trying to go a little bit up now. Ok, tengo un poquito más. Ok, ahora sí, infla. Sí. Now we are inflating again the balloon. Empuja la guía. I'm trying to move all this stone and sludge you can see here. So now we are out. Okay, desinfla. You see? So this is a lot of geometry also, huh? You need to have the good direction to make a drainage. Okay, infla el balón. Rayos. See? Now I'm cleaning. It's still going out. You see how big was this stone? So I prefer to use the balloon over the basket because when we are removing this kind of stones, sometimes the basket can be trapped inside, and I don't like it. So I believe the balloon is okay. If you need to use another balloon, you use it. That's all. But there is still people that like the baskets. Cifralo un poquito. La cifra. You see, we are still removing. Un poquito más, Stent. Voy a subir. Okay. Infla. Infla. Okay, so you can see now that is much better. Look the binary track on the ERCP. La con la geografía en grande, por favor. So you can see, inyecta, one. You can see it's no more the big stone that we had. Now I think it's very clear and clean up, okay? Which is good. It's very good for this patient, right? So the endoscopy evolution has been very important and interesting during the last years. We passed from just diagnosis or diagnostic treatments, diagnosis procedures that we are still doing, right? But now we are doing this kind of surgeries, right? Big surgeries, difficult patients that, you know, had relief the complications that we had with these patients. So nowadays, not just diagnostic, also therapeutic. And which is one of the things that we need to promote more and more in our region, like this one, like Latin America, is to promote, to do good job, good procedures, training more people. You know, you see, is going out just doing my aspiration. If you have a very good dilation, you can do that. Now, infla, okay. I think few more pace. It's just going out. So now I am changed the position. I do aspiration to help the balloon also, you know. The aspiration helps. Even if you don't believe me, huh? You see the stone? It's still there, huh? Oh my god, it's really big, 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 big. It's coming up. It's like a birth of a child. You can see here, it's very big. Okay. Intenta disminuir un poquito el diámetro. So once we are like this, sometimes it's the balloon that is too much inflated, okay? So Juan diminish the size of the balloon now, and I believe we are done. You see? Okay, desinfla. Very good. You see? Now we'll try to make an aspiration. You see? Very good aspiration, and the stone is going out. You see? Very good. I am doing aspiration, more aspiration, and the sludge is going out. You see? Very well. I didn't use the balloon, right? So now I will pass again, and I believe we are done. Okay. 10, 10, 10. Okay. Infla injector. So now we do another injection. So you can see now the very track is well. I don't see like too much sludge inside now. Like the big rock is out. And this is good. This is good. Very good. You see? Oh my god. It's a lot. Vamos a desinflar un poquito, Juan. Desinflar. So now it's coming out. You see? Oh, perfect. Desinfla. Then infla. So you see now, very well. It's coming out everything. So we have at least 1 hour and a half here, right? But I believe we make a good job. Ok, desinfla un poquito, Juan. Desinfla. So I think it's very clear now. It's more clear. Ok, infla el balón. No tanto. Hasta 12. ¿Inflaste? I'm trying to do not put like too much air, because I want like you see, it's just a position deal with the stone. This is very important. Okay, now we are out. Desinfla. Okay. Now. 10. 10. So now I will clean with water. Pasa salina. So I will put saline solution just to clean up more and the sludge going out. Infla. Now Juan Manuel inflate everything. That is good, because it helped me to remove the sludge. You see, I changed the position again to be the same direction of the sludge of my hole, of my opening part. You see, very well, very good. Okay, desinfla. Okay, botamos salina. I will clean up more. Me infla. Inflaste todo. Ah, todo, 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 todo. So now I see the balloon. Okay, desinfla un poquito. Okay, you see? It's coming out. Desinfla. Okay. Mete agua. There's just a slush now, huh? That we need to clean up. That's good. And I think she will be fine. This patient will be fine. Okay. You see now, very good the biliary tract. Okay, infla el balón. Okay, I think we are very fine. We're very good. Ok, desinflemos un poquito, Juan. Now, perfect. Desinfla. I think we really clean up everything. Infla. Perdón, metamos agua primero y inflamos. Porque hay barro en la pared. So what I see is a sludge. You know. But just little, huh? It's just nothing. Almost nothing. In the wall of the common bile duct. You can see there. Okay. Okay. Infla. Sí, ahorita voy a... So, once I finish this now, so very gentle. Now I retake my position again, which is very good. And now you can see I don't see more like stones coming out with the balloon. I see the balloon clear. Okay. Vamos a desinflar un poquito. Okay, desinflo. So now I will pass my cholangoscope and I will review everything. And if everything is okay, I will finish. I will ask for sure. Ursodesoxycholic acid inside, well, not inside, for taking. And once these patients will be fine, we need to review. I believe we'll be fine. She will be fine. So now is a stent inside the biliary tract is a good option, when you don't have this technology like lithotripsy, all this, but you need to retake the patient. The problem is sometimes the patients they believe that they are fine and they just don't coming back. This is probably a little difficult case, but I think it's okay. We need to make pasa la guía. Pasa la guía. Little tricky. This is a 11 French cholangioscope, so it's a little hard to put up. Let's see here. So you can see inside. Now I'm going inside. It's just a slush in the wall of the common bile duct. Not so easy, but there is no more stone. It's very clear, and I believe we remove almost everything. I think this patient needs just follow up. Want to see what is going on inside, if there is any stone inside the biliary tract. So you can see here the rest of the common bile duct. This is the right and left common hepatic duct. So it's clear here. So I believe it's clear. I'm not worried now. So we finish, I believe. This need to be just removed. The balloon will not take it out. I believe it will go out alone. She have a very good papilla dilation, and we need just to review this patient in consultation in 1 month, and then probably if we see something in the MRCP, maybe to make a second cleanup. But you see, it's just a slush. Some small stones, just that. But I will let just a plastic stent just for security for this patient, but a big one. No, después le pasamos. Vamos a ver el filtro más rápido. So I will let a stent just, and in 2 months I will review her. But I believe she will be fine. Ya estoy terminando. Un minuto. It's much better to prevent. So I will pass the sphincterotomy now. Yeah. So we need to change the guide wire. The guide wire is broken now. Pásalo por aquí. Desenreda. Al revés. Sí, si hay 10, 12 mejor. ¿Qué tienes? Si no 10, 10. So I will put a 10 French 12 centimeters 10. So now the guide wire is okay. And we will finish.